Hello, and thank you for joining today. After a full week of webinars, we arrived at our last event from the online version of the ENSP European Conference on Tobacco Control. And in today's event, we will try to portray the road to a smoke-free generation. We have great speakers today that will tackle interesting topics such as tobacco and social media, smoking rates in universities, the role of youth in ensuring a smoke-free generation, but also tobacco school policies. So without further ado, I would like to introduce you our first speaker, Deborah Rosen. From managing political campaigns in the field to strategic consulting for international issues advocacy organizations, Deborah Rosen's 20 years career has focused on finding unique strategies to hold policymakers and global corporations accountable for abusing human rights, labor rights, public health, and the environment. Her work has been featured on CNN, Fox News, and in PR News as example of innovative viral marketing strategies on behalf of NGOs. Deborah currently heads up Take Apart, the tobacco industry corporate campaigning strategy for a campaign for tobacco-free kids. She will present today the topic of tobacco and social media. So, Deborah, the floor is yours.
Thank you. Okay, I'm going to go ahead and share my screen. Hang on. "45% of the world's population are social media users, a whopping 3.5 billion people. As these platforms have grown in popularity over the last decade, corporations have developed increasingly sophisticated social media marketing strategies to promote the use and sale of their products. I'm Deborah Rosen with the Campaign for Tobacco-Free Kids, and today I'm going to walk you through our campaign to stop tobacco marketing on social media, including how the world's largest tobacco companies are using social media to market their products, our campaign progress to date, and what's next. Let's start with some background. There are several ways to advertise on social media that fit into the earned, owned, and paid marketing trifecta many of you are familiar with. In 2015, when we started to examine how tobacco companies were using social media to market their products, all social media companies had a policy in place to not accept money to advertise tobacco products on their official paid advertising platforms. Banned from official paid marketing on social media, tobacco companies turned to a decades-old strategy, exploiting young influencers. Documents disclosed in litigation in the US found tobacco companies have employed a marketing strategy that focused on getting young trendsetters to promote tobacco brands to their social circles dating back to the 1940s. Here is one example of this strategy from British American tobacco-owned R.J. Reynolds. Operation Green Apple targeted young trendsetters for cigarette addiction with the goal of generating new market trends in a strategic and subtle marketing campaign. This strategy was perfect for social media, where as early as 2010, brands started using influencers to market their products to their networks. Influencers in social media are people who have built a reputation for their knowledge and expertise on a specific topic. They make regular posts about that topic on their preferred social media channels and generate large followings of enthusiastic, engaged people who pay close attention to their views. For some, being an influencer is a highly lucrative job. Consider this influencer couple that can make $12,000 per photo posted on their social media account. To find social media influencers, companies can use a variety of influencer search tools, work with PR agencies to find influencers, and analyze their own social media accounts to identify potentially influential fans. We found a video created by one of Philip Morris International's PR companies in Israel showing how they built a successful influencer program for IQOS. Let's check it out. In 2015, we began a 2-year investigation that documented more than 100 social media campaigns using influencers to promote cigarettes. We found these influencer campaigns originated in more than 40 countries, where tobacco companies were secretly, and in some cases illegally, advertising cigarettes on Instagram, Facebook, and Twitter. On Twitter alone, these campaigns were viewed more than 25 billion times around the world in just 2 years. Using social media influencers, branded parties and events, and sponsored contests and giveaways, the campaigns published images, hashtags, and videos designed to look like organic social media content. Through confidential interviews with influencers for cigarette campaigns, we learned tobacco companies seek out young people who have a significant number of followers online and pay them to post photos of cigarette brands. Influencers were trained on what cigarette brands to promote, when to post pictures for maximum exposure, and how to take natural photos that do not look like staged advertisements. And influencers are instructed to include specific hashtags promoting cigarettes on social media posts. With the data collected, in August of 2018, we launched the Where There's Smoke campaign to expose this tobacco industry marketing tactic and pressure social media companies and governments to respond. The launch started with an exclusive expose in the New York Times and a legal complaint filed with the US Federal Trade Commission. 1 month later, partners in Brazil also filed a legal complaint. We also started direct conversations with Facebook, Instagram, and Twitter to update their policies. Tobacco companies immediately responded by denying involvement, and we saw content associated with cigarette marketing campaigns we exposed quietly disappear, coinciding with an increase in content associated with e-cigarettes and heated cigarettes on Facebook, Instagram, and Twitter. In October of 2018, at the 8th session of the WHO Framework Convention on Tobacco Control Conference of the Parties in Geneva, parties decided to establish an intersessional working group to develop specific guidelines under Article 13 of the WHO FCTC addressing cross-border tobacco marketing, including advertising through social media and entertainment media. In May of 2019, a Reuters investigation exposed PMI's use of young influencers. PMI admitted to engaging in influencer marketing and claimed to voluntarily suspend its program. In response, more than 100 public health organizations called on Facebook, Instagram, Snapchat, and Twitter to immediately ban influencer marketing of tobacco products and e-cigarettes. In July, Facebook and Instagram updated their policy to restrict content promoting the sale of tobacco products, but declined to prohibit influencer promotion of tobacco products and e-cigarettes. In December, the UK Advertising Standards Authority ruled that British American Tobacco must stop using public Instagram accounts to promote e-cigarettes in the UK. The ASA also ordered BAT remove all Instagram advertisements for BAT's e-cigarette vape that were part of the investigation. In January of 2020, Snapchat officially updated its policy to prohibit influencer promotion of tobacco products and e-cigarettes. And in February, Facebook and Instagram officially did the same. Since the launch of the campaign, we've achieved amazing results, but there is still more to be done. Twitter has not yet acted to update its policy, and there remain significant loopholes in Facebook and Instagram's policy. First, this policy is reactive, which means users need to report violating content to set off a review process to have it removed. Second, remember that paid, earned, owned marketing trifecta? Now prohibited from using influencers to promote tobacco products and e-cigarettes on Instagram and Facebook, tobacco companies have turned their attention to building their own presence with branded product pages. These pages are country and brand specific, regularly updated with promotional content, staffed with brand representatives available for live chat, and direct visitors to online sales sites. And finally, during the COVID-19 pandemic, we saw an increase in influencer promotions on social media of nicotine pouches, with significant pushes in low and middle income countries. These products are not currently covered by Facebook and Instagram's policy. We recently provided recommended policy changes to Facebook and are continuing to pressure them to close these loopholes. To find out more or get involved in the campaign, visit wherethere'ssmoke.social or contact me at drosen@tobaccofreekids.org.
Thank you very much, Deborah, for the interesting presentation. I'm sure that there are a lot of things to discuss in the breakout rooms later. And just as a short recap, we have seen the first presentation out of 4. We have 3 more, and after these presentations, we will pass to the practical part, the exercise, where people will be split in 4 breakout rooms, and they will discuss about challenges and potential solutions to these problems that our speakers will present. So, without further ado, I will introduce you our next speaker, Sofia Ravara, who is a consultant in pulmonology and assistant professor of preventive medicine and epidemiology at the University Hospital of Beira Interior in Portugal. She is also associate researcher at National School of Public Health at Nova University in Lisbon. Her research interests are prevention and control of respiratory disease, lifestyle medicine, and medical education. Her work as a respiratory physician in major hospitals gave her the understanding on how tobacco harms population health. She holds a master's degree in tobacco control at Cantabria University in Spain and has been working in hospital-based smoking cessation clinics, workplace cessation programs, hospital smoke-free network, and health professional trainings. Today, she will tackle the topic of tobacco use among university students. Please, Sophia, the floor is yours.
Thank you, Karina, for your very nice introduction. And good morning, everyone. It's a pleasure to participate in this ENSP-ECTC Roundtable, the Road for Smoke-Free Generation. And I'm really delightful to talk about this topic because it is something that it's my work, everyday work, and it's also what I teach and what I research, and it's all about what I do. So usually we all know that most smokers, the great majority of smokers, they begin smoking, experiment smoking during their teenage ages, but in young adulthood, it's also a very problematic period because most smokers actually, after they experiment, they move forward to regular use and develop nicotine dependence on these early adult life, in their early adult lives. So that's the period where young adulthood when they progress to regular smoking, either intermittent or occasional smoking or daily smoking. They may show escalation in nicotine dependence, and we also know that if smokers quit at this early age, they have the best health gains, and also they will become parents soon. And role modeling is so important in smoking that it's really important to prevent and to promote cessation among these early age of young adults. But we also know that young adults, more and more, they are entering college and university. And we also know that this is a very stressful period of transition for young adults. For them, it's the first time living away from the family home, and living environment is a very important factor while considering health behavior risks, and particularly smoking. And the literature and research knows that there is high rates, not only of health behavior risks, they are highly prevalent among college students, smoking, but also other health behavior risks, like low physical activities, alcohol consumption, and drug use. Usually these unhealthy behaviors and smoker particularly associates with other unhealthy behaviors, so they and there are some trends, for example, in health and sports schools. Usually it's more of concern alcohol and alcohol use, and arts and humanity and communication schools, it's more smoking and drug use. So smoking prevention and cessation efforts among college students are also crucial for tobacco control. I'm not going to present smoking rates, but just to show that although in some countries very advanced in tobacco control, like for example, United States of America, where smoking has been declined over the past decades, tobacco use is still very common in young adults and college students, and it remaining a serious public health concern. Although the trend is very light smoking, we know that all tobacco use, there is no safe use of tobacco use. And this very light smoking combines with the use of other emergent tobacco nicotine products, shisha, cigars, and e-cigarettes. E-cigarettes actually are the most prominent tobacco use in United States of America, and although in these young adults and college students, and it's becoming also in Europe and other parts of the world. And it is also very of particular concern that this type of tobacco nicotine products use is associated with alcohol consumption and marijuana use. And dual use, of course, is a concern because it promotes addiction, and it also increases health risks. This is one of the studies that we have done in our university. We are serving each 4 years the students, and trying to understand not only what is happening to the prevalence, if it's going down, but also the trends of tobacco and nicotine use, and other health behavior. And I just want to notice that in this study, while we compared in the trends and the prevalence in 2012 with 2014, and now we have also the data from 2020, what we have observed is that the tobacco experimentation didn't go down, and there is no difference between younger students and finalists. So it seems that medical school doesn't prevent students from experimenting tobacco use and other nicotine products. But however, most of these medical students, they have low nicotine dependence. That means they will easily quit if we help them to quit. And what is more, with what we have also noticed is that they are experimenting a lot of products. So while the most common product is boxed cigarettes, as you can see here, they are, the second one is shisha, roll on, and then you have also roll your own tobacco, cigars, cigarillos, e-cigarettes. About 10% of medical students are experimenting e-cigarettes, and also even pipe and oral tobacco that is forbidden to sell in Portugal. They are also experimenting. Hello? Oh, sorry, I couldn't progress. We also asked them if they are aware, if they are being targeted by the tobacco industry, and particularly at college parties and social events. And as you can see here, you can say that the great majority agrees that they are being targeted by the tobacco industry, and that the tobacco industry knows very well what are the better settings and their social activities, and these are the places where the industry is promoting their products. So what about prevention of health behavior risks and smoking among college students and young adults? Well, we know that most prevention efforts mostly focus on teens using their natural settings and mass media, but there is a lack of research targeting young adults and college students, and in terms of effective interventions that may lead to the adoption of healthy behaviors and reduce smoking behavior and other health risk behaviors. So, on the other hand, we know that more young adults are attending college, so college campus provide a great setting for primary and secondary smoking prevention, as well as smoking cessation efforts targeting young adults. So we know that tobacco industry strategically promotes tobacco use among young adults and college students, integrating tobacco use in activities and places that are relevant for young adults, and in this case for college students. And there is also research, especially in the United States, showing that the industry really promotes their products using the college parties and their social activities. What about research studying prevention in smoking use among college students? What we know, does it work? What we know is that research is very limited. So there is really a gap research on smoking prevention among university students. Most research is cross-sectional, so it has a lot of limitations. So we need more research, we need more longitudinal and qualitative studies, and we need more intervention studies, and we need, of course, qualitative studies to understand better this phenomenon, but also to involve more the students, and also the college staff and the college managers. However, although this research is limited, current data indicate that stricter, more comprehensive and enforced policies, incorporating 100% smoke-free campus, they work better in terms of reducing tobacco use. There is less evidence regarding cessation programs and integrating prevention and cessation models into the curriculum of college students. And there is also sufficient research to understand that partial smoke-free campus, they don't work on reducing tobacco use, although they may reduce exposure to secondhand smoke. So to conclude with, tobacco use and health behavior risks is a serious public health concern among college students. Experimentation of multiple tobacco products, new emergent nicotine products, and light intermittent use is the current trend. College students are being aggressively targeted by the tobacco industry. College campus provide a great setting for primary and secondary smoking prevention, as well as smoking cessation efforts targeting young adults. Tobacco prevention policies provides a more healthful environment for students, staff, faculty, and visitors. Comprehensive smoke-free policies work, and there is a need for tobacco control and prevention research and advocacy action in the university settings. Thank you very much for your attention.
Thank you, Sophia. Very, very interesting presentation. I just wanted to suggest, if you have any questions, please type them in the chat, and our speakers will answer to them. So now let me introduce you our next speaker from Slovenia, Andrej, who is a graduated medical doctor from Ljubljana. He spent most of his student years working in youth organizations such as the Slovenian Medical Students International Committee or International Federation of Medical Students Association, where he has served as volunteer and later in executive board positions. His first employment after graduation was in Youth Network No Excuse Slovenia, where he worked as a public health associate. Today, he works as a consultant for several public health organizations working in the field of youth health. His work has included designing preventing programs for youth, advocating for better health policies in the field of addictions, and training youth activists who want to make the world a better place. He currently holds the position of the president of the International Youth Health Organization and will share with us today a presentation on the role of youth in the smoke-free generation. So please, Andrej, the floor is yours.
Thank you very much, Karina. And it's great to be here. Thank you so much for this invitation. So I had a bit of a misunderstanding. I thought I would be speaking to a youth group today, but nonetheless, I believe that most of you are young at heart, and we can flip the presentation around a little bit so that everybody can take something from it and maybe how to engage with youth, even if you're not a youth organization. So even though I'm representing the Youth Health Organization today, my story will be mostly about my particular experience and the experience of a youth organization that is also our member, and that's No Excuse Slovenia, as really a best practice in the field of tobacco control and involving youth in that. So, so this is also for a little bit of the framing. Otherwise, our organization works with different youth organizations across Europe, covering different topics, not only tobacco control, but also alcohol control, nutrition and physical activity, mental health, and other topics that are important to young people and their health. Okay, starting off with this. This is, today I'll tell you a little bit of a story, and that's a story of success. And I bet that all of you would be proud to receive the plaque like this that we got in 2019, or the No Excuse Slovenia got in 2019 from the WHO, an award on the work on tobacco control. And really, for any advocate, I think for any tobacco control advocate, that is the best you can get, and that is a really good recognition. But what was it given for? Basically, you might or might not know, Slovenia has one of the strictest tobacco control laws in the world right now, with the new law that was adopted in 2018. And this law covers things like plain packaging, complete ban of advertisement, including e-cigarettes and new tobacco products, licenses for selling of tobacco products, among other things. And for that we achieved that, it was essential, or if we go to different stakeholders within the country, it was essential the role that the youth organization played in pushing this legislation being adopted. But this was 2018. That our story didn't start there. And I think that's also very important for you to realize, if you want to start with youth, that a lot of times the beginnings are actually very different and very humble. And that's also how it started with No Excuse Slovenia. This was even before my time, actually. So in 2016, the network was formed, and it started working on different projects, much like a lot of youth organizations do. So they believed it was important to raise awareness among their peers on what the problem tobacco actually is. But what made them a little bit unique to maybe other youth organizations or other advocates is that they didn't highlight the problem that tobacco poses for health of young people or of the population, but they worked strictly on, or not strictly, but focused more on exposing the industry and the industry tactics, which is something that we already heard about in the first video or the first presentation. Of course, at the time, there was not much social media, but they used other tactics. And in No Excuse, they also, at that time, thought it was very important to make some sort of a statement, some sort of a claim that things need to change. And so they did that with the Slovene and the European Youth Manifesto on Tobacco Control, which was also the first, at least in Slovenia, the first youth manifesto on tobacco control. And that's how it started. And it was met with opposition, it was met with ridicule at some points, but the young activists really believed in their work and they continue working. Soon after, they went only from promoters to informants. Now, even promotional activities, they increased a lot. In 2012, I believe that No Excuse Slovenia reached half of all young people in schools in Slovenia in 1 year. So over 100,000 school, let's say children or school pupils were exposed to this knowledge about the industry tactics and the manipulation that the industry does. So we really managed to cover a big range of people. But that was not the only thing that the organization was doing. We also started engaging in research activities that some of them were quite simple and some of them were quite elaborate. And already we started then collaborating with different institutions, such as the faculty for social affairs in Slovenia and even Johns Hopkins School of Public Health later on. We started connecting with certain organizations that are also here today, such as Campaign for Tobacco-Free Kids. And we collaborated as young people. We managed to use our strengths to play the parts where nobody else could. For example, mystery shopping. So what we could do is have young people, underage people, go into shops, try to buy tobacco products, even though it was prohibited to sell tobacco products to anyone underage. But we could do it, and that's what we were doing. We were seeing how many tobacco sellers actually adhere to the legislation, and what we saw was that a vast majority don't. So we're talking percentage of 95% of all tries to buy tobacco products were successful, quote unquote, so that the underage youth could actually buy the tobacco products. And on top of that, we're also playing the role of watchdogs. So seeing that advertisement at that time was also banned to a certain degree, we were exposing this and also informing to the inspectorate if any of these legislations were broken. And finally, all of these data that we got basically from our research, we also used then to advocate for stronger legislation to what we have today. So we did not only generate the data, but we spoke to the press, we spoke to the parliamentarians. We actually went into the parliament when the discussions of the laws were. We even exposed the industry when we were there, and that, step by step allowed us to really push this agenda forward. Now, of course, it was not all plain sailing. There were quite some challenges along the way. At the beginning, people not taking youth seriously. This is still a stereotype that a lot of youth organizations face. People saying that, young people are not experienced, that they don't have the necessary knowledge, they don't have the necessary skills, that they don't know what they're saying, or they are idealistic. And this was exactly what happened with the first manifesto. But guess what? 15 years later, most of the things that were written in the manifesto are now in the Slovene law. So who's laughing now, right? But then also taking a little bit more of a serious note, if you take teenagers, 15-year-olds, 16-year-olds, because that's the age when, when we started working of our activists, there is some sort of lack of knowledge, but that needs to be addressed. It doesn't mean that because of inexperience, young people are incapable, but it just means that they need specific support. And I'll come to how we can find solutions to these challenges a little bit later on. There's also quite a big issue of funding youth organizations, because sort of it is assumed that young people, young activists will do everything voluntarily, but it's very difficult to actually dedicate a lot of time and to have big expectations of these young people if you don't give them the appropriate space, the appropriate resources to be able to pull off projects like that. And then finally is also industry interference. And here I can tell you, let's say, I want to share with you two examples. So one was maybe it's quite recent, also from the mystery shopping research that we were doing. One of the activists was, let's say, exposed. There was a news piece in one of the newspapers that was significantly influenced by one of the tobacco companies, saying that what these young people are doing is immoral, that it's not correct, that they cannot pretend to be of age, and then they reveal themselves that they're not when there is an inspector nearby. So they really try to turn the story around, making it sound like the people who were exposing illegal deeds were doing actually something illegal. And of course, that can have a very profound effect on the young activist that was there. Imagine this was a girl aged 16, 17, and if you get a paper piece on yourself saying that you're being immoral or this is not ethical, of course that can have a significant effect. Another more positive story on the industry interference was regarding this man over here. That's Dr. Bojan Pretner, and he's a specialist on intellectual property, and he was saying that plain packaging is a violation of that law. And we had on good authority that he was connected somehow to the tobacco industry, and even though he was denying it all the time, we did some, let's say, dirty work, went into searching online, and we saw that there were quite clear ties with the US Chamber of Commerce to him, and that they were being funded by the tobacco industry. And we exposed him in a way that's saying, okay, so do you have any ties with the tobacco industry? No, I don't. Okay, so then what is this? And we showed the paper showing the connection, and from then on, he disappeared. So this is also something that not only youth organizations, but NGOs in general can do, because they have much less interest to think about. So that's maybe their role, to really be shouty, to really say things that are maybe a little bit awkward to say for other institutions that have to keep other interests in mind. And this is really how, as a youth organization, we manage to beat these challenges. So first of all, what is extremely important is having important partnerships. And this is where I would address all of you to see, that it was essential for us to have government support. So the Ministry of Health, for example, was a very key player in supporting our work, both with knowledge, also with some funding. Other NGOs, I also see some representatives here, both in the Slovene space, but also internationally. So NGOs like ENSP, networks, campaign for tobacco-free kids. We, as I mentioned earlier, we also work with academic institutions, and this can really be a good collaboration in projects like mystery shopping, for example. And then finally, also press is also very important. And of course, they like to promote stories like the industry is manipulating our young generations, and they pick up on that. But it's also a double-edged sword, because we have encountered in the past that a lot of press was also under the influence of the tobacco industry. And then finally, what I was saying earlier, regarding the inexperience, what you need is not get older people, but just provide capacity building and support for these people, and you'll get future health advocates. And then finally, of course, hard work and persistence. When it does get tough, and it does, as you know, with industry interference, with battling on titans that have billions of euros and dollars, and you barely have enough for maybe even a paycheck. It's very important to believe in what you're doing and to keep at it, and then results like the ones we have will arrive at some point. So that's very, in short, about this presentation. If you have any questions, we can discuss them later on in the breakout rooms, but I hope you find this informative. Thank you.
Thank you very much, Andrei. Congratulations once again for the great achievements. We all know that Slovenia plays an important role in the tobacco control community. Yes, I believe that the discussions will be very rich. So now we will pass to our final speaker, Nora Melar. She is a teaching assistant at the Faculty of Public Health and PhD student at the Institute for Health and Safety with Professor Vincent Laurent at Université Catholique de Louvain in Brussels. Her research focuses on school tobacco policies and adolescent smoking. Regarding her background, she has a bachelor in marketing in Brussels with a double diploma from Aberdeen University of Dundee in Scotland and master's degrees in human decision science and in health promotion and education from Maastricht University. Today she will discuss about school tobacco policies and adolescent smoking. And Nora, I will leave the floor to you to explain us the project.
Thank you. It's the Institute of Health and Society. I don't want to have any problems with that. Okay, hi everyone. Yeah, I'm going to talk to you today about the school tobacco policies. We've briefly talked about it with the previous presentation from Sophia, but here we target specifically the adolescents. So adolescents are actually, oh wait, sorry, I can't, there, okay. Adolescents are a very vulnerable part of the population. They usually are easily influenced and tend to not be aware of the addiction effect of cigarettes. In 2018, it's still 1 out of 7 adolescents that report smoking. And to decrease this high rate of smoking, tobacco control policies have been put in place for years now, and among them, school tobacco policies. However, there are still inconsistent evidence in the literature regarding the effectiveness of these policies. So today I'll show you a quick study on school tobacco policies and how to kind of evaluate them, actually, because there are no clear definition in the literature on how to evaluate these policies. I will also show you a few results from the Sydney R project and some information on adolescent smoking that we gathered. The data were collected from the Sydney and Sydney R surveys. They were collected in 7 cities, in 7 European countries. There's also Dublin among these only 6 cities that appear actually. And the data were collected in 38 schools in both 2013 and 2016. Overall, we gathered information on more than 18,000 students from 3rd and 4th grade. That's the secondary school, so it's on average 15 years old. And we have information on more than 400 staff members. And one of the difficulty was to actually evaluate this school tobacco policy. And how we did that is that we computed a score that used different dimensions of the policy. So we took into account the comprehensiveness, the enforcement, and the communication of the rule in the school. And we also tried as much as possible to take into account both the perceptions of students and the perception of staff members. So here are some findings on adolescent smoking. So those are the adolescents who reported smoking at least once a week. So you see in green the data for 2013 and in blue the data for 2016 and the different countries or cities actually in which we collected the data. So you can see that overall there was a decrease in weekly smoking among adolescents, but it's quite striking still the difference across cities from one country to another one. More specifically, because we focus on school tobacco policies, here are some outcomes that are more related to the school. So smoking on school premises and smoking just outside school premises. There were fewer smokers who reported smoking on school premises in 2016 than in 2013. And there were similar numbers who reported smoking just outside the school premises. So these are quite raw data, but I thought that maybe it would be of interest of you to see to have a more overall view of the situation actually in the cities we gathered the data from. So here you see, we asked them the question of how easy it was to get access to cigarettes. And you have the data for each country. And again, you see that some results are actually quite interesting. Like it's very, again, different from one country to another one. For example, we have here in Coimbra, oops. No, in, oh, there is a problem, sorry. I think this is supposed to be Germany. Yeah, sorry about that. I don't know what happened with these colors. Okay, but from one country to another one, it's very different. Here we asked them how often did they see students smoking on school premises? And again, it's quite striking in some countries, the difference. I see teachers smoking on school premises, and we go back to that aspect of role modeling, that you actually see the teachers who are supposed to give you this example at school and who actually smoke in the school premises. Sometimes it's designated areas, of course, but as Sophia said in her presentation, 100% smoke-free schools usually are more effective. And then I see people smoking just outside school premises, and here the numbers are crazy because, again, I'll go back to that, but you see that there's actually still a high visibility of smoking outside school. And these are the data for 2016 only. So we looked at the evolution of the score of school tobacco policies, and there was, across schools, there was an increase in every STP dimension, except for staff perception and of enforcement. And this was actually the sanctions. I'll get back to that after. But these changes were very small, and there were many variations between schools. So in schools, they really did worse between the 2 years, and in some schools, they really tried to enforce many other rules. And the dimension that varied the most with time in both perception was comprehensiveness. And the enforcement score was for both the student and the school staff perception, the lowest score, which is quite troubling. So we looked at the association between the total STP score, the score that translated the school tobacco policy in place. And we looked at the association with the different outcomes, so smoking on school premises, smoking just outside school premises, and weekly smoking. And we could find an association with smoking on school premises, so with a higher, with a stronger school tobacco policy in place, there were less likelihood of smoking on school premises, but we didn't find any association with the two other outcomes. So overall, stronger school tobacco policies led to a lower likelihood of smoking on school premises. So the school tobacco policy just does the job on the school premises. And it's mostly the student perceived enforcement that was associated with this likelihood. So we see here the importance of a strict policy with no tolerance, actually. Stronger school tobacco policies were not associated with less smoking just outside school premises. So there's actually no impact on the entrance and the surroundings of schools. So this actually maintains the visibility of tobacco. So one recommendation would be to extend school tobacco policies to the school surroundings. And some schools have already done that, the students were not allowed to smoke as long as you could see them from the school premises or at the entrance. stronger school tobacco policies were not associated with less smoking overall, so weekly smoking. And this shows that there's no real effect of this policy outside the school setting, but we have, of course, to take into account that STPs are part of a broader approach to reduce smoking. There are other tobacco policies next to that. And we saw very low scores of enforcement, and specifically for sanctions. And it's because this score was using what type of sanction they were using, whether it was a disciplinary sanction, like to get the tobacco from the student, or to give him some work to do or whatever. Or next to that, you had more educational and counseling strategies, and these were more rated, but way less used in the schools. So another recommendation would be to promote education and counseling strategies on top of these disciplinary sanctions, and to really see like when someone is breaking the rules, not seen as a disciplinary problem only, but also as a health problem. Thank you very much.
Thank you very much, Nora, for the presentation. And for those who are interested in the findings of the project, they can see more details on the CNR website. I see that we are running a little late, so I will jump directly in the exercise. As I said in the beginning, this today's event will have two parts. The first part was the presentation of the speakers, and now we will jump in the second part where the practical exercise will start. What is this? Actually, you will be all split in 4 rooms. I will assign you randomly to one of the 4 rooms. Each room will be focused on one topic that our speakers presented. And of course, the speaker will be the moderator of this room. What you will have to do there is, well, first have the tour of the table and present yourself, and then try to discuss the challenges based on these topics. And of course, what are the solutions that you propose? What we want to do is to have you a little more engaged with our panelists, to hear your ideas, and hopefully to gather them and try to implement them in our next year youth group activity in the ENSP. So I don't know if there are any questions until now. If not, I will already try to create the rooms, and you will receive a notification. Oh, and please do not quit the room. I will send you a notification to come back in the plenary and to discuss the ideas that you already discussed in the breakout rooms. If you quit the session before you receive the notification, you will be actually quitting the event, and it will be harder for you to join back. So by now you will start to receive the notifications. Let's wait a few more seconds for our people to come back. In the meantime, did you manage to assign the role of presenter to someone that will briefly present the ideas? Because we are running late, each group will have something like 2 minutes to share with us what they have been brainstorming.
And I will be the one reporting on school policies.
Okay. Well, let's start in the same order as the agenda, and start with the social media and tobacco topic first. I don't know who wants to present from your group.
We did not select a presenter, but I'm going to let, yep, go ahead.
Well, if nobody wants, maybe Deborah, you can share with us the ideas.
Well, we sure. So we talked about, we spent a lot of time really talking about the challenges of tobacco companies marketing to youth, using social media, especially to market to youth. some of the biggest challenges that folks in the group pointed out were how the marketing, the materials that are seen on social media are very modern, they're fresh campaigns, the events appeal to young people, and it's a really great challenge to compete with because of all of the money behind it. It was also pointed out that, you know, when tobacco companies are caught doing one thing that they shouldn't have been doing, they're very resilient and they change tactics. So trying to keep up with them is hard, but definitely keeping ahead of them is really hard. We talked a little bit about, we had a lot of great sort of young advocates in our group who talked about sort of how in their sort of social circles, smoking is sort of associated with being a coping mechanism, and that's how folks in their networks see it, and that's reinforced by films and media that sort of show smoking as something that could be an effective stress relief, and that's been really difficult for encouraging youth. We also talked about the, you know, in thinking about how young organizations, particularly organizations that don't have a lot of funding, you know, how they could really be powerful and stand up to the industry. And one of the points made was how, you know, one of the currencies that youth organizations have that tobacco companies don't have, that they really can't buy, is youth advocates, youth voices, which are really compelling with decision makers, as well as the general public. I think that of all of the sort of victims of the tobacco industry, young people are the ones that consistently motivate lawmakers to take action. And we talked about some examples of where that's been effective in the past. And that's it.
Okay, great. These are good good ideas to have in mind for next projects. Very interesting. So for the second group on smoke-free campuses, Sophia, who will be presenting from your side? I think you're muted.
Yeah.
You're speaking.
Hi everyone. I will be presenting, and we have discussed, and we were very fortunate to have not only a teacher, Sophia, like me, the same name, also Italian teacher in Rome, but also we had a GP working at university doing smoking prevention and working at a smoke-free campus, but also some students. And we discussed, are you seeing my presentation?
Yes.
Yep.
Yes.
Okay. So as challenges, first of all, we need national legislation on comprehensive tobacco-free campus. It's very difficult to implement a smoke-free campus or tobacco-free campus if you don't have a good legislation, a comprehensive legislation. Also, enforcement, it's very important, it's crucial. And it's another challenge is that we don't have funding. It's difficult to raise fundings on this. And then we discussed the solutions. I think it's the most important. First of all, we think we have to raise awareness on this topic. And the best thing would be to involve youth and students associations to show how to raise awareness, how college campus are a great setting for prevention and even to smoking cessation efforts among college students and young adults. Also to put the spotlight in the tobacco industry and other industries, not only the tobacco industry, the food industry, the alcohol industry, is even the bar and I don't know how to say in English, the diversion industry. We say in Portugal, but I don't know how you say the industry of the nightclubs and so. And all these industries are working together, and they are targeting college students. I think it's very important to also to promote peer education. And we thought about that perhaps it would be better because health behaviors cluster, that this peer education would focus not only in smoking, but other health risk behaviors. So it would be peer education, lifestyle, and health promotion. So put the focus on health promotion among youth, and would be, I think would be very convenient to launch a smoke-free campus network across Europe. I'm not sure if this exists. And of course, we would like to involve ENSP, but we also would like to involve Slovenia. No excuse, youth organization, because you have been fantastic, and you have you're doing excellent work, and we could learn with you, and you could help us, because I know you're already working with the students organizations. Tobacco-free kids, if you want to join us, that would be great. And we think we need also to do to raise funding to have research, because as for example Andrew has told us, we need data, and through the data and doing research, we can convince decision makers, and we can advocacies based. There's no advocacy without a good research agenda. So, and it's not very difficult to do research in these topics without with little money. So I think it's an opportunity. Thank you very much.
Thank you, Sophia. Very interesting, the proposal with the Smoke-Free Campuses network, and maybe we should keep in touch and see what we can do regarding this. So for the next group, the third group was Andrei with...
Yeah. And I will also be presenting. I was volunteered by the others. So we mostly focused on the challenges, really, and then we sort of ran out of time. Some of them I already mentioned earlier in my presentation, such as lack of funding, or that the competition of other organizations is a little bit maybe unfair, because it's there's a bias to give funding to established organizations, and sometimes youth organizations are not that. Other than that, it's sometimes difficult to put tobacco control on the agenda of young people because of conflicting interests or conflicting obligations. For example, medical students that are working on several different health topics, and then tobacco is just one of them, or even just looking at it from a wider perspective, just the fact that young people have, you know, other things to do, like school, like studying, jobs even. And this is usually in a volunteer position, a volunteer situation. So we need to find ways to get around that, or maybe provide professional positions also for young people, so that they can work with greater capacity in that sense. Sometimes working with young people, it can also be, especially with organized young people, so organizations can be difficult because their turnover periods are very short. So if you, for example, work with, again, I'll give an example of medical students, their leadership might change every year. So some sort of commitment that you made with one board might not hold true the next board. And it's difficult to invest in a group of people if then after a year they leave and all your investments are sort of, there's a low return on them. And then finally, one of the biggest challenges for youth in this time are definitely the novel products, novel tobacco products in general. And they are really a new entry point for young smokers, as we've seen also in the presentations today. Now, maybe a few words on the solutions regarding addressing youth, let's say, is really about making partnerships with them, so that, for example, together they can apply for funding opportunities, and that tackles a few of the challenges that we mentioned. So one is the funding issue, another one is the competition issue, a third one is the capacity building issue or professionalizing issue. Another solution is to create binding documents or agreements to last over a few years, so that it's not only an oral agreement with the leadership of one, let's say, student club, but it's like a memorandum of understanding that takes place over a few years. And then finally, maybe I would point out also to have information campaigns, and that mostly goes now to the part on, let's say, novel tobacco products. For example, what we found also in the past is that informing young people that smoking is unhealthy didn't really go very far. However, when you expose the industry and when you debunk myths, so that's where it really makes sense to raise awareness, because raising awareness that tobacco is bad is like blowing into the air. Everybody knows that, right? But not everybody knows that the novel tobacco products are just as harmful, or that they are a cause of certain diseases that young people might think that they are healthy or rather less harmful alternatives. And that's where it's worth to invest resources into raising awareness. So that would maybe be in short. I also see that we're running out of time, so maybe I would give the word to the last group.
Thank you. Yes, we will pass directly to Paulina, and please keep it short so we can also close this meeting in time.
Yeah, I'll just make the points that we mentioned in our discussion like very quick. So first we started with comprehensiveness of smoking policy, and the word that we kept repeating was universal. So what we all agreed is on that it's important to try to make the smoke-free policy 100% without any exceptions. Anna, can you hear me?
Yes. Yes, go on.
Karina?
Yes. Can you hear me?
Okay, I'm sorry. I think my internet got disrupted for a second.
I personally.
Karina? Hey, am I back online?
Yes.
Well, maybe.
Can you hear me now?
Yes. Maybe if Paulina has troubles with her internet, Nora or someone else from the group could present.
Yes. So we didn't share notes. So Paulina, I don't know if you want to use the conversation to add something.
Well, please be really short.
Yeah, of course. So what mostly came out of our discussion is really the universal aspect of policies and specifically school tobacco policies. We discussed about the fact that school staff members should also be very realizing their impacts on adolescent smoking, and when they smoke within the school premises, they should also maybe be more discreet, have rather areas that are not visible to the students, and yeah, I don't know what else.
But I'm back online, so I reloaded.
Perfect.
So I can take over. So just a quick notice, we discussed that how to make this 100% smoke-free policy. So ideally, if it comes on national level, if it's a smoke-free law for the country, if that's not possible or it's not in place yet, then it should be a ministry directive or Ministry of Education or Health together, obliging all educational institutes to follow this policy, or at least to be done with initiative each school to do it on a school level at least. That makes it sort of a matter of equality, that there's no discussion if it's fair or not fair, if in one school it exists and another school it's different. So it's easy, let's say, to put the penalties or some disciplinary measures in place for teachers that are fair and respected by everybody. but also the teachers, as they are the role models, and also such a factor as the risk of third-hand smoke. Even if they smoke far somewhere from students, they still bring some particles of tobacco that can be dangerous for kids. We discussed that it's a matter of sort of educating them and maybe providing cessation help to staff that smokes. And with regards to designated areas, it's a very difficult issue. If they should be on school grounds, they should be outside school grounds. But what we heard from one young participant in our group, from her experience from school, she shared that actually having a designated area on the school ground creates social inequalities, separating the people, kids in groups, and maybe if they already belong to a more vulnerable group, they will be isolated from the rest of their peers, and it creates not only health but also social inequalities. So that's pretty much it.
Okay. Okay. Thank you. Very interesting. Very interesting ideas from all groups, and yes, and as I said, hopefully we can start to implement them as soon as possible in the ENSP youth group. On the same note, if there are people interested to join the ENSP youth group, you can contact the ENSP secretariat at any time. And yes, I think this is mainly it for today's event. Even though we were running a little late, I hope that it was an interesting meeting for you. I hope that you managed to engage with this with our panelists, that you managed to have interesting discussions and to have a new idea on the tobacco control community. Now I think we can end this meeting and end this full week of webinars. Please know that this is not the last webinar of the ENSP-ECTC. More events will follow in 2021. Hopefully we can meet in person. Yes, I wish you happy holidays and a happy new year.
Happy holidays, everyone. Bye-bye.
Happy holidays.
Bye.
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 Thank you.
For this call. Happy